The state of Kansas is grappling with a serious public health crisis, a large-scale outbreak of tuberculosis or TB. This outbreak, primarily affecting Wyandotte and Johnson counties, has raised concerns among health officials and the public alike. As of January 2025, the outbreak has resulted in a significant number of infections, marking it as the largest in the United States in recent history. This outbreak is deeply troubling because it signifies a resurgence of a disease that was once thought to be under control. The first cases connected to this outbreak were identified in early 2024. Since then, the number of cases has steadily risen, prompting a swift response from local and national health authorities. The outbreak's timeline underscores the speed at which TB can spread within a community. It also highlights the challenges in containing the disease once it takes hold. The situation in Kansas is a stark reminder that TB continues to pose a significant threat to public health. The outbreak serves as a wake-up call for increased vigilance, early detection, and comprehensive control measures. Understanding the scale and timeline of this outbreak is crucial for both healthcare providers and the public. Tuberculosis, often referred to as TB, is a contagious bacterial infection that primarily affects the lungs. However, it can also spread to other parts of the body, including the kidneys, spine, and brain. The disease spreads through the air, much like the common cold or flu. When a person with active TB in their lungs coughs, sneezes, speaks, or even sings, tiny droplets containing the bacteria are released into the air. These droplets can remain suspended in the air for hours, potentially infecting individuals who inhale them. It's important to note that not everyone infected with TB bacteria becomes sick. There are two types of TB infection: latent TB infection and active TB disease. People with latent TB infection carry the bacteria in their body but do not exhibit symptoms and cannot spread the disease. However, they are at risk of developing active TB disease, especially if their immune system weakens. Active TB disease, on the other hand, causes symptoms and is contagious. The good news is that tuberculosis is a treatable disease. Treatment typically involves a strict regimen of multiple antibiotics taken over several months. The specific combination of antibiotics and the duration of treatment depend on factors like the patient's age, overall health, and whether the TB strain is drug-resistant. Adhering to the prescribed medication regimen is crucial for successful treatment and to prevent the development of drug-resistant TB. Local health departments in Kansas are playing a critical role in managing this outbreak. They are providing testing for the bacteria that cause TB, connecting individuals with the appropriate care, and ensuring access to medication, including free treatment for those without insurance. Public health officials are also conducting contact tracing, which involves identifying and testing individuals who may have come into close contact with infected individuals. Public health education is another essential aspect of outbreak control. Health authorities are working to raise awareness about TB, its symptoms, and how it spreads. This includes providing information to the public through various channels, such as community meetings, public service announcements, and online resources. While the current outbreak in Kansas is alarming, it's essential to understand this situation within the broader context of national TB trends. Although the overall rate of TB in the United States is relatively low, recent years have witnessed a concerning uptick in cases. This trend underscores the importance of continued vigilance and public health efforts to combat TB. The recent outbreak in Kansas, coupled with the rising national trend, highlights the need for increased investment in TB prevention, detection, and treatment programs. This includes strengthening public health infrastructure, improving access to care for vulnerable populations, and promoting research and development of new TB diagnostic tools, vaccines, and treatments. The fight against TB requires a multifaceted approach that involves not only healthcare professionals, but also policymakers, community leaders, and the public. By working together, we can strive to control and ultimately eliminate this preventable and treatable disease.